Welcome back. Joining us now is Bruce Ward of the BC Dental Association. Hey there, Bruce.
Hi.
Bruce, dentistry, well, it's expensive to pay for our teeth, and so we have dental plans, which is a good thing, but there's so many and they're varied, and maybe let's start with what a basic dental plan is, and then you can start giving me the Cadillac versions.
Dental plans are actually great. They're great for dentists, they're great for patients, they're great for companies because they actually allow people to get dental work that they need. Dental plans are usually benefits that companies provide for their employees, and they're sold through many different insurance companies. There's many different plans, and a company decides on which plan they want to provide for their employees. And the company chooses the plan based on what they want to give their employees in terms of cash benefits and amounts of coverage. So some plans cover everything that their employees need at the dentist. They're 100% plans for the basic work, for cleanings and for exams and for fillings, restorations, root canals. Those things are usually covered under the basic part of a dental plan. And many companies provide 100% coverage for that. Other companies provide 80% coverage for that. So if you're an employee who has a dental plan that covers 80% of your basic work, it means you have a 20% deductible to pay each time you go in to see the dentist. So some people think that because they have a dental plan, everything's covered. But if their company's only bought them a plan that covers 80%, it really means that only 80% of their dental work is covered, of the basic work. Then if you want things like crowns and bridges, dentures, things like that, those are usually covered under a different schedule, and those are usually covered half by dental plans.
It's really important to be knowledgeable about what the plan is,
Yes.
and then relative to each kind of procedure you might be getting, rechecking what you might end up paying or whether it's covered.
Well, as dentists, we're bombarded by people who have many different plans, and we can't expect to know what your company has bought for you as an employee. So quite often we ask people on their first appointment, or if their plans change, to bring in their information so that we can actually find out what they are and what they aren't covered for. But at the end of the day, it really is up to the patient to know what they have in terms of their benefit from their employer.
Is it ever possible to negotiate a fee with a dentist? Can you sort of say, well, I'll come to you if you only charge this much? I mean, is it that competitive out there?
In British Columbia, we have a recommended fee guide. So there's a fee guide that gives recommendations as to what we pay and what we don't pay. And a lot of the dental plans pay according to the recommended fee guide. But in British Columbia, as across the country, dentists aren't tied to the fee guide. They can charge above the fee guide. They can charge below the fee guide. They can really set their own fees. What's important to the business, and it's important to the patient, is that the dentist really charges the same fee for everyone. So they're not charging some people less than other people, because all of a sudden you're getting into two different fee guides and two different layers of treatment. But a lot of people ask why dentistry is so expensive. I do know that in dentistry, because it's all private, it shows up more that way. And I have a brother who's a pediatrician in the Fraser Valley, and he and I set up our offices about the same time. I set up my dental office, he set up his pediatrician practice. My office probably costs 7 or 8 times what his cost to set it up, because I have such a need for advanced equipment. We do all of our procedures in our office. We don't go to the hospital. We don't perform those things. So the dental chairs, the dental x-rays, the technology that we need in order to have all of this stuff work is extremely expensive. So many offices run at a very small profit margin, and people don't see that. They just see the total cost.
Well, bottom line is we need the work done. I'm glad you're there.
Thanks.
Thanks, Bruce.
North of 49, a guide to the rest of your life.